Welcome, everybody, for our series for the AAPM&R, where we are introducing you all to the future leaders of the world of physiatry. These are members of the AAPM&R who have been out of practice for about 3 to 10 years, who have been in a 2-year program through the AAPM&R called the Future Leaders Program. So today I have the honor of interviewing Dr. Kush Goyal. Do you want to introduce yourself? Tell me where you're from, where you trained, and what you do in the world of physiatry.
Yeah, so I'm Kush Goyal. I'm from Cleveland Clinic. I'm in our Center for Spine and Pain. I'm a Cleveland native, so I grew up here. I went to college at University of Michigan. Actually, I was a surgery resident for a couple years before switching into PM&R, and which I was one of the best decisions of my life, of course. And then I was fortunate enough to get a spine medicine fellowship at Cleveland Clinic, and then was fortunate to stay on as staff there for the last. Um, Actually, now it's my 13th year.
Got it. And you could have picked anything. I'm sure there's a lot of what we would say, really chill careers in medicine. What pulled you from surgery in the OR, the wheeling and dealing of the emergencies, to this great field of physiatry?
Well, I'll keep this short because it could be longer, but it's actually one of my former medical students. I was a surgery resident. He was a medical student. He actually was t asking, what do I like about surgery? And I mentioned, certain things like hands-on specialization, post-operative care, and, cancer, sports, all those things. And he's like, all those things you can do in PM&R. And he's like, I think you might be interested. You should look into that. And then fast forward, I interviewed at a program, was accepted, and that person had a large impact on my life.
That's amazing. And that goes to show you, the previous situation of you being meaner to your junior. If you're nice to the next generation, you never know this gold that they just give to you. So I always tell everybody, be nice to your med students because they may be your bosses one day. And one of
Yeah.
your future leaders program people, Dr. Max Fitzgerald, is at my institution. He was my former resident, but now
Uh,
he's big time at Rush. So we're so proud of him. He's in charge of all these things from a chief medical officer perspective. So proud of him. So those things do happen. So
oh yeah, he was one of the great to connect with him. It's part of the program is you get to meet really people who are inspiring and can also motivate you too.
awesome. No, and this goes to kind of my question because you did this 2-year program. I mean, it's a lot of work. What inspired you to get involved with the Future Leaders Program, and what do you hope to accomplish?
Yeah, I knew about it a few years ago. I actually applied to it before, um, and was not chosen, but eventually, sometimes perseverance pays through. One of my partners, Dr. Deborah Vennessy at Cleveland Clinic, she was former president of the society and had encouraged me to apply. And then I talked to another future leader, Dr. DJ Kennedy, and he also encouraged me to apply. So I kind of persevered and applied again and again, and it worked out, and I was lucky to be chosen. Yeah, it is a 2-year commitment, uh, but they really make some of the programs fun and um, try to make it convenient. We always try to work around our schedules together. They do a great job of planning.
Awesome. And with the education and the experiences that you're getting, what do you envision this experience will take you and allow you to do?
Well, first off, is you get a lot of exposure to the board of directors at in the academy. So for me, I have been in practice 12 years, and I've exposures to leaders in my own institution. But sometimes you want to get exposures to others at um, different programs, whether academic or private practice, and you kind of want to see how you can help your own society. So you learn a lot about how the academy runs and how decisions get made and actually how you can get involved. So I learned a little bit more about how I could get involved within the society, um, but also, I get exposure to possible leadership training or making connections, media training. So these are a couple pieces that I think potentially could help me in my future.
Cool. Now, with the Futures Leaders Program, which you've been doing for the last 2 years and attending different meetings, different courses. What's been the most impactful experience that you feel makes you really happy to have done this program?
My favorite part was going to the Board of Governors meeting, Illinois. So we met with the board of directors, most of them in person. And not only were we a part of the meeting, we were at the table with the Board of Governors. Like we were a part of the team. And our role was not just to listen, but they actually wanted each of our opinions on the issues that the academy faces. So we learned a lot about the historical issues over the last 5 to 10 years, the current challenges and the future challenges. So I was impressed, amazed, honored that they were so open-minded about hearing our opinion, with the people who've been running the organization. So I felt very included and felt like they really wanted to know our opinion. That was my favorite part so far of this Future Leaders program. Great
Wonderful.
thing.
Things. I know you're all, I believe, going to DC doing some very important advocacy work on our behalf.
Capitol Hill. So
Um,
that'll be coming up in about 2 months. I know there was a good impact last year, and I talked to one of the other physicians who lobbied, and that was pretty impactful for him.
Wonderful. I just imagine just a very daunting task going to Capitol Hill, and trying to advocate for us when we're trying to balance all those things that a lot of people need. Um, for you, and I know you're a spine physician, a pain physician in the world of PMR. Are there specific touch points that are very important to you? Some big threats to our field that, if you had it your way, this is what you would try to tell a senator or a representative to focus on.
So um, there are threats from insurance companies about interventional procedures getting covered, and we've seen a few of those see that happen over the last few years. So like sacral lateral branch RFA has been something that hasn't been covered for a couple of years, but is a very helpful procedure that I personally enjoy doing and have had a lot of success. And then kind of along the same lines, the Medicare is looking at some peripheral joint procedures, um, and potentially contesting the current evidence, which it actually is very good. I myself have published on this as well. So one particular injection, just to keep it limited, is knee geniculate blocks and knee geniculate RFAs. So these are very helpful procedures with people with chronic knee pain, beyond just having a steroid injection in the office, which a lot of PMR doctors do. But it's another thing we can do from an interventional side that is a little bit getting threatened, from our insurance coverage.
Yeah. And insurance companies, if they find the study that tells them something is not beneficial, they're going to make the choice to say, well, we can't cover it. And all it takes is for enough reps to look at that study and say, we agree with you. So we need people like you, who are going to be able to advocate and put the eyes on the right studies that show what works and doesn't work. Because I know you're honest stand-up guy. You wouldn't be doing it for the sake of doing it. And,
Yeah.
and of course, I think there's a lot of things in the AAPMR where they're promoting research. So I think you're highlighting there's a need for not only people like you, but people in the research track and research program to be able to get the good data for the advocates like you to go and speak for them and plastered all over the walls of the Senate and the House. So we are able to be supported to be able to help patients.
Yeah, yeah,
So,
yeah,
yeah.
absolutely. Really excited to be a part of it and do our best.
Oh, I'm sure it'll be amazing. And I'm looking forward to all those pictures that you're going to be taking. It's going to be up on social media. So I'm going to be
Yeah.
rooting for you guys. Um, and if there is someone, I was telling my residents today, I was telling them about Dr. Fitzgerald and the program that he was doing. And I was telling him I was going to do this interview today. And I said, listen, you should look at these YouTube videos to see and what people are doing to be inspired. If you were able to speak to a resident right now who's thinking about doing this, but they obviously have a couple of years before they're able to apply, what do
Yeah.
you think is important for them to do to be able to fill their CV so the APMR views them as a leader? And what would be a reason for them to want to even consider this program?
It's an excellent question. Again, I applied for this program more than once. I'll admit that. So again, I mean, for me, I had done a lot of clinical research and membership involvement with some other societies. So that's what kind of helped was bring me a candidate for this program. And I also kind of helped develop a chronic pain program at Cleveland Clinic I was one of many people involved. So I kind of talked about things that I've helped develop, but you know, I could potentially learn more from others and how they develop programs and maybe streamline things or make things, more efficient. Or even, start programs that are with multi-institutional or do multi-institutional studies. So you really get exposure to people who've already done that, and you can learn from not necessarily their mistakes, but from their process and their experience.
Cool. And I think we'll end with hopefully a fun question because you said you're from Cleveland and I believe you went to University of Michigan, correct?
Hmm. Oh
So
yeah.
you had a football championship recently, and then of course you had the LeBron NBA championship. Which
Yeah,
was
two.
which was more impactful for you that brought a smile to your face in the kid in you? And well, not to say the other one was was not that great.
Um, I mean, if you don't know me that well, but you know me actually very well now, because those are two of the happiest moments of my life besides, meeting my wife and being married. Um, that trumps. But apart from that, from a sports point of view, definitely the NBA championship is with LeBron in the 2016 year is the best. I also was a freshman in 1997 when Michigan won the championship, and I went to the championship game. So I had experienced the championship as a college student, which was unforgettable. But the one recently, I was not able to attend the game because of work. But I I was along for the ride and I enjoyed it with a lot of my friends and family.
You've lived a charmed life from Charles Woodson to McCarthy, the quarterback.
Yeah,
Although
yeah.
Charles Woodson, he was my idol growing up. I love Charles Woodson. He was the best. Awesome. I think that's a fair thing. Wife, marriage, number one. We'll give it a
Hmm.
couple of slots just to save you some any heartache later today, and then
Yep.
maybe 10 and below. We'll say it's your Cleveland championship, and then your University of Michigan championship. So
Yeah.
awesome. It was really great talking to you, and we're really excited for what the Future Leaders Program will bring with the advocacy work. And we look forward to seeing you being all over the APMR, hopefully signing some autographs sometime soon because you're on TV doing some cool stuff.
Well, thank you, Dr. Kazi. It was a pleasure to talk to you about this, and hopefully we'll connect more in the future.